Fernando. Early voting starts soon, and I want to go over Amendment 4 with you. Some people have expressed that the wording is a little unclear, so I'd like to clarify that with you. And everything that I share with you is just facts only. It's not my opinion, because my opinion does not matter. I just want you to be an informed voter when you go to the polls. Amendment 4. No law shall prohibit, penalize, delay, or restrict abortion before viability or when necessary to protect the patient's health, as determined by the patient's healthcare provider. This amendment does not change the legislature's constitutional authority to require notification to a parent or guardian before a minor has an abortion. The proposed amendment would result in significantly more abortions and fewer live births per year in Florida. Florida's current law for abortion is up to 6 weeks gestation, which is when the heartbeat starts. If you've been raped, if it was incest or human trafficking, it goes up to 15 weeks gestation. If the mother's life is at stake, then it's the third trimester, which is up to 9 months. The difference between the current law and this amendment is the fact that the sentence here, when necessary to protect a patient's health, that leaves it open to interpretation, which means it could be mental health, not just physical harm to the mother. Let's take a look at the funding part. Currently, under Florida law, taxpayers do not pay for abortions. But in this bill, it says there is also uncertainty about whether the amendment will require the state to subsidize abortions with public funds. Litigation to resolve those and other uncertainties will result in additional costs to the state government and state courts that will negatively impact the state budget. And again, it sounds like it's leaving it open to interpretations on whether the taxpayers will be paying for this. I want to go back to the very beginning of this bill and look at the word viable. Viable means being able to survive outside of the uterus. And at what age does a doctor consider a fetus viable? Usually around 22 weeks. Now, I want to show you a picture of a baby that was born about 22 weeks old. And this is him 4 months later when he was well enough to leave the hospital. Now here's what a fetus looks like from 16 weeks all the way to 26 weeks, which is 6.5 months pregnant. If you've never had an abortion or you don't know how one is performed, I'm going to share this healthcare physician's video with you. It's an animation of an abortion. If you don't want to see it, I suggest you stop the video here.
My name is Dr. Anthony Levatino. I'm a practicing obstetrician gynecologist, and I've performed over 1,200 abortions. Today I'm going to describe a second trimester surgical abortion called dilatation and evacuation, or D&E. A D&E is performed between 13 and 24 weeks of pregnancy. After administering anesthesia, the abortionist uses a weighted speculum, like this one, that opens the vagina widely. Because second trimester babies are so large, this greater access facilitates a late-term abortion. Late-term abortion requires that the cervix be prepared 24 to 48 hours in advance with laminaria. Laminaria is a type of sterilized seaweed that absorbs water over 8 to 12 hours and swells to several times its original diameter. Once removed, metal dilators can be used to further open the cervix as needed. Once the cervix has been stretched open, the suction tube is placed inside. A baby at 20 weeks gestation is as big as the length of my hand, from head to rump, not counting the legs. The suction machine is turned on, and pale yellow amniotic fluid surrounding the baby is suctioned out through the catheters. The babies this big, they don't fit through catheters this size. The baby's bones and skull are too strong to be torn apart by suction alone. This is a Sofer clamp. A Sofer clamp is made of stainless steel. It's about 13 inches long. The business end is about 2.5 inches long and 1/2 inch wide, and there are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. The abortionist uses this clamp to grasp an arm or leg. Once he has a firm grip, the abortionist pulls hard in order to tear the limb from the baby's body. One by one, the rest of the limbs are removed, along with the intestines, the spine, and the heart and lungs. Usually the most difficult part of the procedure is extracting the baby's head, which is about the size of a large plum at 20 weeks. The head is grasped and crushed. The abortionist knows he has crushed the skull when a white substance comes out of the cervix. This was the baby's brains. The abortionist then removes skull pieces. He removes the placenta and any leftover parts of the baby with a curette, scraping the lining of the uterus for any remaining tissue. The abortionist then collects the baby parts and reassembles them to make sure that there are 2 arms, 2 legs, and all the pieces. Once all the parts have been accounted for, the abortion is complete. For the woman, this procedure carries a significant risk of major complications.
Either way you vote, just be an informed voter and know what you're voting for.